How many times have I been asked the question, how did you do it? I ask, sometimes I'll say, how did I do what? Because it's been part of what we've been doing for a long period of time. And it's, how did we go independent? Well, having been asked that question enough times, I came up with a few steps that you may be able to emulate yourself so that you can go independent or go as independent as you want. You can decide whether you want to work with referral sources some of the time or all of the time or none of the time. You can determine who your referral sources are. It's one of the best parts about being independent. You can decide who you want to treat, and you don't have to do anything that you don't want to do. And you can treat in exactly the way that you want to treat. So when you go home at night, you can really feel good about what you've done. So let's go over some of these points and see how you can relate to those points as well.
And always remember, I think the best part about this organization is that we don't just talk and talk. We walk the walk every day. We work in this practice 4 days a week, and we've learned from the experiences. We learned from feeling the burn and feeling the pain and having the fear and finding things that work to get us through it. So when we're talking about these things, we do it. We do this every single day, and it works for us, and we want to share that with you.
Right. And the advantage is you don't see anything that failed for us.
And if it did, we're not talking about
that's
it.
Right, we're not talking about that. So there were a lot of failures along the way of success, and you have the opportunity of just emulating the success and make it a lot easier for yourself.
So step 1, appoint an office manager.
Oh, really? Yeah, that's you.
Get me.
So why should I appoint you? What's so good about you? Or forget about it, I know what's so good about you. But what's so good about an office manager? Why do you need one?
Because you need to be seeing the patient, treatment planning the patient, doing surgery on the patient. You don't have time to see staff conflicts, patient upsets, numbers going up and down, all those problems of the practice. You don't need to be involved in that, because that's going to interfere in acceptance. That's going to interfere with referrals. It's going to interfere with success of surgeries. So my job is to keep that off your plate.
Okay.
That's why you need me.
And you do that.
Yes.
You do that. I mean, there's a certain filter that Danielle is, so that Danielle will filter the things that I need to know, or she may decide the time that I need to know. If it's something negative, she's not going to hit me with that at 8 o'clock.
5:30.
But I know she sits down with me at 5:30. It's not going to be something that is too pleasant to deal with, but I have to deal with it.
Yes.
But most often, Danielle does it herself, and
Yes.
I don't have to be involved in the process at all.
Right, correct. So very important, step number 1, don't forget, get an office manager. And she may already be working with you. Maybe she's your surgical assistant. That's how I started. Maybe she's answers the phone. Maybe she does something in the back. It doesn't have to be someone who's qualified or has been a manager in the past. I never was. It's just somebody that you work well with, somebody that you can share information with, somebody you trust, somebody that will share the excitement of the growth of the practice, that the staff likes. Staff has to, get along with them, like them. So appoint that person so that you can start downloading to the office manager. You can start giving her all the ideas, all the concerns, all the fears, all the issues at the beginning of the day, and then she takes care of it all during the day. So you can do what you do best.
A staff member has a certain innate quality. But a staff member also, I'm talking about an office manager, has an innate quality. You can kind of tell she's a leader, and as Danielle said, everybody likes her. But there's a certain amount of training that's involved in that as well. So let's talk about staff training. So staff training is attribute number 2.
Yes.
You just, by the way, when you are in this position, I'm talking about running an organization. I've heard it. I want somebody to come to me that's already trained and I can just plug her in. You know what? That person has never existed in our practice, and I doubt is going to exist in your practice too, because your practice is going to be different from anybody, from everyone else. You need to invest in staff training, and by the way, you need to set the standards for what that staff member should be doing.
Right. Yes. So for us, staff training, we do staff training once a week. We have a staff meeting once a week. So, and I'm not really talking about much on the staff meeting, because with staff meetings, we go over the flaps and handlings that we have discussed before, the wins, the stats, and our game plan for the week. Staff training in this example that we're using is we do train staff to our standards. We do train staff on how we like them to work with each other, how we like them to interact with the patients, how we like them to introducing our organization, our structures, our systems, so that they have all that knowledge and they understand our standards.
That's right. And so there is that, and then there's formal training as well. You need to
Yes.
look at someone and say, all right, I'm not really capable of doing everything that needs to be done, or it's I don't have enough time, but there are organizations that do that kind of training, and communication training, sales training is a typical example of two areas where we send out to an organization that actually does that and specializes in that. So yes, there are things that you can do, and there are things you need to be willing to um, or areas where you need to be willing to invest in order to be able to get that staff member trained to the level where he or she can actually perform to the level that we need.
And we will go over more of that as well on one of our webinars. But like Dr. Sheldon was saying, you have your clinical training sheet. So someone who's new coming on to the front desk, answering phones, doing clinical, they have a checklist. They have a training checklist they have to complete so that they can be out of training mode, out of probation. They can be trained to work in the practice. We also have a secondary training sheet, and it's called an ethics training sheet, I call it. And that's where they understand our philosophies, our standards, what we like patients to be educated on, what the practice believes in, what everything from how to treat a patient to each individual staff member, to knowing our website, to knowing the books that you've written, to knowing everything about it. So when patients ask them, they don't say, well, I've never read that book. I don't know. What, we have a website? I don't know a website. So we want our staff to be educated on who we are and what we do so that they can share that with patients in the office, outside of the office. So it's very important, and we'll go over that more in this
Good.
season as well.
And you'll increase the number of resources that you have in your practice, and as you increase those, that becomes part of that checklist that needs to be done. So yeah, I mean, if you haven't written a book, it doesn't absolve you of the responsibility for actually having the training checklist on things that you have written, or even references that you refer to.
And our next one is start a marketing program.
Yeah, well, how important is that? So if we look at a marketing program is something which gets not only your name out there, but it draws patients in. When we first started our marketing program, I did all of the marketing myself. I'm not necessarily recommending at this particular time that you do your own marketing. It's difficult. And frankly, just as I hire an office manager to take care of the internal aspects of the practice, there are marketing companies out there who do a spectacular job, and they can do it for you. And frankly, it's much more cost effective, both from a time standpoint as well as from a financial standpoint, to let them do it rather than you're doing it. Doesn't mean that you don't monitor what the marketing company is doing, come up with suggestions, or not even suggestions, but come up with reports to the marketing company, letting the marketing company know what's going on, so the marketing company can tweak what they are doing in order to be able to help your practice. You need to have enough statistics in place to be able to market. You might even ask the marketing company what statistics you need to put in place, but I'll tell you, the one statistic that makes all the difference in the world in a marketing plan is number of new patients in the office. It isn't number of hits, number of reads, number of views, number of anything. It's number of new patients coming into your practice. Part of that is what the marketing company is doing for you, and part of it, of course, is what your staff member, particularly your phone scheduler, is doing in order to be able to make sure that that patient who calls your office actually schedules.
Right, and that's another thing that we are going to expand quite a bit on this season, because we have had a big demand on that, is marketing. We're going to have some guest speakers of who we use. We're going to share with you what we do as far as the marketing, but not only who we use, but how we do it, because I don't think we've ever hired a company and said, here, do this for us.
Yeah.
We said, here, do it, but let us help you. Let's help you.
Yeah,
So
sure.
we've recreated a lot of these. So not only are we going to show you who we use, we're going to show you how we have made it successful, which is very important.
That's right. And in some of these programs, you've already seen some of these people already. So, just take advantage of that. That's why you get the DVDs. So you can go back and you can look at it and say, all right, now I understand what they were driving at when they were talking about these individual principles.
Next one is add to your public relations.
Yeah, and how important is public relations? If we look at public relations, if we look at what we're doing and what we do outside,
right?
You can market all you want. I mean, you can throw something out there and have somebody come back in. You can. But there's a certain magnetic attraction that you can develop all yourself. And that magnetic attraction actually determines how many people actually want to come in as a result of some of the things that you do. I mean, so some of the things that we do are charitable giving campaign. And we've gone over that in the past, and we'll go over that again. Writing, and writing is key for public relations. Whether you write a paper, or whether you write a chapter, or whether you write a book, writing is key. There are other things that you're doing within the community in order to be able to raise your level of prominence in the community. And whether you're on TV, or whether you're on radio, or whether you contribute to Rotary, or whether you lead a club, or whether you lead an organization, all of these things raise your public relations in your community. It's very important to your community. Don't just do it in order to be able to make your practice better. Oh, it's so fake. It really is. Find something you like to do and that is good for the community and that you can get excited about. And frankly, you can pull that into your marketing. You can put that on your website. You can put it in areas where people will be interested. Oh, he's really interested in coaching Little League. Well, that's great. That's what we're talking about.
Yeah, and it's something that, like Dr. Sheldon said, you become passionate about it, you love it. Like the charitable giving campaign. When patients know, or out before they even become patients, know how much you've donated to all these local charities that really need the help, that you have the articles that you write in the newspaper. And it's not just dental articles, it's medical articles that you're writing. They see your face in the newspaper. Stuff that you've volunteered for, worked with. People in your community should know who you are by name. They should know who Dr. Smith is. And when they hear that name, they know exactly who you are. And when people say, hey, I have a missing tooth or a toothache, or they should say, you should call Dr. Smith. I've heard great things about him. So it's really important, especially when you're breaking away from the referral chains, because now the patients that are coming in from the referrals are coming because Dr. So-and-so said great things about you and said, go see that person. So now that if you don't have that anymore, or if you have it less, your community should know who you are. They're getting referrals from their neighbors, their family, their friends. So PR is very, very important in this.
Good. Yeah. Create a strategic alliance with only the best restorative dentists in town. You want to make sure that the work that you do is complemented by the work that the restorative dentist does. Now, I know there's a tendency to want to get more restorative dentists into the fold. And so now that you're seeing patients on your own because of your marketing and your public relations, now you want to send it, oh, I'll give him something. Don't give him something unless he's proven, or she's proven, in fact, that she's capable of delivering the work that needs to be done in order to be able to make sure that you're proud of the final product. Because if you're not, there's heartache at the other end. So work with the best restorative dentist. I guarantee you there's no restorative dentist in your area that won't welcome referrals from you.
Next one, increase your diagnostic and treatment planning skills.
Yeah, now if we're talking about treatment planning skills, we're talking about actually treatment planning at the chair, and we talk about this a lot. I know you're sick of hearing it, but we're talking about being able to diagnose and treatment plan everything at the chair.
Right.
That's it.
Good. Next one. Monitor.
Yeah, so just because you think you can do it, if you're not looking at what's going on.
If you're not looking.
I'll tell you, there are so many people say, oh, I have 90% acceptance rate. Yeah, right. The only people who have 90% success rate are either marketing very, very small plans, and so, yeah, we can have a 90% success rate in scheduling and cleaning, or you're oblivious to what you're doing. Okay, the only way you're going to be able to look at that, or you're a heck of a lot better than I am, and that may be true. The only way you're going to be able to know how well you're doing is to make sure that the critical statistics are kept in your practice. They're kept on a daily, weekly, monthly basis, and you look at them and you learn from them. The watched statistic may very well go up simply because you're watching it. So watch it, and of course we teach a lot of things with regard to statistics, but make sure first you're keeping track of the critical statistics. So what are the critical statistics in our office? Number of new patients, dollar volume of production, dollar volume of income. Those are the three main stats in our office. Are there others? Of course there are others. There are others based upon individual performances. So we'll look at the financial arrangements assistant and look at dollar volume of of acceptance. We'll also look at percentage of acceptance or treatment acceptance. Because if that person runs at a particular rate and all of a sudden drops off, we want to find out, well, what's going on with you? What's happened? Not that we're yelling at her, but I guarantee you, if it goes like this and it goes like that, this person has something else going on either within the practice or more likely outside of the practice that's disturbing her performance within the practice. Well, if you're not keeping the statistics, or if she isn't keeping the statistic, how do we know? So it's important to be able to monitor that.
Another thing that we're going to go over a bit more in this season, and how do you do that? It's not looking at your yearly stats. It's looking at your weekly stats. Because if you wait for a whole year to see that things are declining, it's gone. So it's watching this stuff weekly. It's having checklists created so that you're reminded. I need reminders because I'm so busy all day long to check phone calls, check stats, check the schedule, make sure we have the right number of new patients scheduled, that it's a full productive schedule. So it may not be you or your office manager doing it, but you have these checklists created so that people remember to check this every single day. And for me, I have the doctors, I have my leads in my departments, and I have the staff. And so I require from them to turn me in these checklists, these graphs, these stats, so that I know things are in check. We have things like block scheduling. We have things like a minimum number of new patients scheduled per week. We have things like checklists being turned in to make sure we're checking the new patient phone calls, so checking people who are answering the phones, making sure they're doing it correctly, that their tone is correct, that everything is going right. Because there are so many times that I have spoken to doctors and they say, my girls are the best on the phone. I know we don't need help in that area. And then I call. So, and then I record it and I show these to the doctors and they're like, wow, I had no idea. So of course, staff members are going to perform the best when you're standing right there. It's what are they doing when you're not there? And it's I'm not saying that you can't trust anybody, but you've got to know what's going on or you lose control of that. And we'll talk more about that this season as well.
Good. As you find the marketing strategies work, if you find particular strategies that work, augment them. Just plug more money into those strategies. Don't necessarily broaden yourself out until you've maximized the particular the marketing strategy that you're using. From many marketing strategies, you can run a pilot program. You don't have to put a lot of money into them. And then once you see them, then you can expand out. Google AdWords is a good example. So you might put $500 or $1,000 into a Google AdWords campaign, and you find out there's a certain number of new patients that are calling in. Well, fine. Then put another $1,000 into it, and see if more patients call as a result. That's a typical example of how that might work. Dental implant lecture, same thing. If you see something that's working, then continue to augment that and get more people to your dental implant lecture.
And number 9 is to streamline your schedule. So as we had spoken about a little bit before, is to make sure that you have a minimum amount of new patients per week. And don't deviate from that. Don't take away a new patient slot to put in an emergency surgery. You have to keep that amount of new patients per week to make sure you have a certain amount of production per week. And the block scheduling that we're going to talk about as well, which is a pretty hot topic right now, because if you have block scheduling and if you have template scheduling in, then your numbers are going to stay pretty consistent.
You are. I mean, there are a number of doctors that say, well, I'll fit in a new patient between surgeries. That's essentially like taking a car, going on the highway, and then going on a mud run with the same car. It doesn't work. So, we're geared to a certain area. Let's make sure we're concentrating on that area and do it very, very well. New patients is a real good example of that.
And the last one is?
Let's see. After we've done 1 through 9, then reevaluate everything. Okay, that's part of monitor. Yes. Make sure you're looking at everything. Reevaluate it, look at it all over again, see what else you can do to make your practice even better.
All right, so that's our 10 steps to independence. We hope you have enjoyed this video. If you have any questions in regards to it, please email us.
The American Association of Independent Periodontists is there to help every periodontal practice do better. I'm Dr. Lee Sheldon.
And I'm Danielle Dorner. We'll see you on the next video.